It's hard to be poor no matter where you live. It's harder in the suburbs. So low-income suburban neighborhoods, concentrated areas where poverty is concentrated, are suffering from disinvestment. Folks in this country, I'm one of them, invest our savings in housing. We expect it to go up in value. That's how we build wealth. If we live in more affluent neighborhoods, that does happen. Remember, growing share of total U.S. income held by upper income households. It's a self-fulfilling prophecy. They continue to make each other wealthy because they bid up prices for things that they want, whether it's stocks or houses. Poorer folks sharing a smaller piece of the pie leads to disinvestment, the loss of the value, the loss of the personal wealth invested in a house. Lower income households who move from areas served by public transit to areas that are much more auto-dependent have a particular challenge. Basically, this chart tells you that the more you earn, the more likely you are to commute by car to a job. And we may say, well, gee, that means lower income folks are being more environmentally responsible. There's actually another story at work here. Folks who have lower incomes have a much harder time affording certainly more than one car. It costs $10,000 to $12,000 a year or more, depending on the source you look at. And this comes from folks like the American Automobile Association who, kind of advocate for owning a car, to own and operate a car. Poverty incomes get up to maybe the mid-40s, depending on how many kids you have, maybe 50,000 in high-wage regions. Can you imagine at $40,000 a year, 2 adults, a couple of kids, trying to afford 2 cars at even $10,000 a year to own and operate? Can't do it. First of all, they're being pushed to suburbs that are further and further out with longer and longer commutes. And remember, lower income folks are much less likely to work in jobs where remote work is a possibility. This is not a hybrid work community we are talking about. These are folks who have to get to their job. If they're, lucky, it's in a hospital, for example. They have sometimes 2-hour or longer commutes to get to work because they live very far out, and they may end up using transit because 2 of them work, 1 has a car, which means that they're changing buses, 4 times on the way to get to work. But now let's imagine some other dimensions of this. If you have trouble affording a car, certainly more than 1 car, one of you works and needs that car, how do the rest of you get to school, get to the hospital, or to visit a doctor, get to see friends who live in a spread out, auto-dependent environment? You are isolated. You're isolated from the things you need to build a better life and from each other. This same auto-dependence, the lowered incentive to walk because there are places you would want to walk to, work, school, friends, shopping, etc., and the difficulty in using transit as an alternative is having a real impact on public health. So when you move somebody holding income constant from an urban core where that's largely walkable to a suburban area that is auto-dependent, it has the same consequence as cutting income in half, because lower income households have, frankly, for lots of reasons, worse health outcomes. It's particularly a trigger for diabetes, for depression. You can read the Alzheimer's, interestingly, various kinds of cancer. All are associated with lower densities, particularly moving from walkable to auto-dependent environments. The CDC basically reports that the number of sort of public health issues quadruples for populations that live in auto-dependent versus walkable environments. It's the various forms that this takes were really interesting. I was startled in doing this research. Lower income suburbanites are much less likely to have serious conditions diagnosed at an early point when it's possible to deal with them. Emergency departments are much further away. Accessing a hospital or emergency care is difficult in high poverty suburbs, particularly areas with concentrated poverty, Because you know what? These aren't good markets for hospitals or medical practices. They tend to be located in more affluent areas for reasons that I don't need to explain. And again, think one car, somebody's off at work. How does the rest of the family get to the doctor, get to an emergency room when they need to? They don't. Nor is help on the way. And this, to me, is one of the sadder aspects of this story. Obamacare, I should say, despite the virtues that many of us see in it, has done relatively little to address the very apparent challenges facing the suburban poor. Again, a majority of poor folks in this country in dealing with the health issues, the challenges that I just talked about. Another dimension to this, which something I learned about from a fellow named Dr. Eric Anthony Johnson, who was the Director of Economic Development in the city of Dallas, a former client, is something that I hadn't thought a lot about, but he has thought a lot about because he's often at the frontier dealing with equity and inclusion issues in suburbs and other communities. And as he put it, I'll paraphrase his quote, "Suburbs are far less likely than cities to have the kind of local governance that is influenced by social, economic, racial change. They are basically set up to maximize efficiency, not response to change." And one of the things that Dr. Johnson has pointed out to me is that because suburbs and local government tends to be, is elected, but tends to be elected in off-year elections, a lot of folks of lower incomes, the folks most in need, tend to be the ones least likely to vote. And that sort of preserves the lack of response to change in suburban government, even in the face of growing challenges. And Scott Allard, the University of Washington, has pointed out that urban counties spend 10 times as much per person to support poor residents as suburban ones, end quote. And you know what? This is a function of politics because urban counties, urban communities, they are structured politically and in many other ways in terms of nonprofits to respond to change and changing needs. We're going to move to Chapter 5 in a minute, building strategies for more equitable, inclusive suburbs. I want to note, though, one topic I have not addressed is education, because increasingly suburban school systems are shifting from a majority of more affluent, educated white kids coming from relatively more educated, affluent families. I know I'm cartooning, but that was certainly the dominant assumption for many decades, to being places where the poor in this country are educated, particularly poor folks, kids of color, and these school systems are not set up, equipped, or funded to respond to these, to them, new challenges.